Which of the following conditions is most likely cause of this patient's anemia? 45-year-old woman, history of systemic lupus erythematosus, presents with fatigue and pallor. Lab tests reveal a hemoglobin level of 8, and then peripheral blood smear shows schistocytes. She has no history of bleeding disorder. Okay, schistocytes. Schistocytes is whenever you get sheared, so there is hemolysis going on. I mean, um, not iron deficiency, not. Okay, I'm thinking autoimmune hemolytic anemia because she has lupus, which is already an autoimmune disease, and then schistocytes is a sign of hemolysis as well.
Okay, so it's actually microangiopathic. So
Dang.
yeah, good idea. But so how do schistocytes happen? Let's talk about that first.
Schistocytes happen. I think it. I think it depends, but it's like whenever the red blood cells are being lysed by um no, I'm thinking different. I know they're being lysed, but I don't remember how.
So schistocytes, you're very close. It's like when I remember schistocytes are being sheared. You know what I
Mhm.
mean? So if you remember what schistocytes look like, they look like kind of like fragmented red blood cells, right?
Mhm.
And the reason why that happens is they kind of get sheared or kind of like pieces of them break off kind of as they're getting destroyed in the lumen of a vessel. So that's how schistocytes end up happening, right? Um, but for instance, give you an example. Look at iron deficient anemia. You're not going to get schistocytes. You're going to just get overall decrease of red blood cells because you don't have enough iron. Sickle cell anemia, you're going to actually see sickling of the cell, so not going to see that. Vitamin B12, you're going to get macrocytic anemia. So you should get between these two. But autoimmune hemolytic anemia, you actually don't get schistocytes. You just get red blood cells that get tagged and get eaten up. Does that make sense?
Mm.
So the key is the schistocytes here. So SLE or lupus can give you autoimmune hemolytic anemia or microangiopathic hemolytic anemia. The difference here is that they give you the schistocytes. So the schistocytes is mechanical damage to the red blood cells as they pass through damage or obstructive small blood vessels. So, like for instance, vasculitis and endothelial damage from lupus can give you microangiopathic hemolytic anemia. But autoimmune hemolytic anemia, you're creating like either IgG or IgM, which then causes, right, like the spleen or your macrophage to eat up your red blood cells. So you're not going to shear them. Does that make sense? They just completely like get destroyed. So you're not going to see schistocytes.
Yeah. Okay.
So
Yep.
just very, very small difference. Like I said, you're like so close, like you're just missing a little bit there, right?
Oh,
But it's not it's
frustrating.
it's not much. Say it again.
It's so frustrating. I'm like right there.
Yeah. So all these questions, like as I'm going through with you, you have the right kind of risk factors in your mind, right? You're just missing that small detail. Like for instance, like, oh, like what are schistocytes and how do schistocytes happen? You understand what I'm saying? So
Hmm.
once you learn that, then you're like, oh yeah, this has to be microangiopathic hemolytic anemia because that's a shearing force, right? Schistocytes for shearing, meaning that it has to be that. Autoimmune hemolytic anemia means that it's tagged by IgG or IgM, and then right your spleen or macrophages or whatnot will eat up those red blood cells, so you won't create schistocytes.
Got it.